Like we've been saying, most of the patients that I treat and people with insomnia and chronic sleep problems feel incredibly unique in their problem. Even when they're talking to somebody else who might have a sleep problem, it might present very differently. And they're absolutely right, down to what happens to them exactly in the night, to how it makes them feel, to whether that happens every single night versus seasonal. You know, it's different in winter and summer versus when they're working, when they're not. It can present incredibly differently. The only sort of, I'd say, connecting factors between everyone are the nuances I've picked up over 15 years of working with insomnia patients. And so that you do look incredibly different. And that's very true. You do have this unique problem and it's affecting you in a unique way. But the nuances that we pick up on are things like the behaviours that we tend to do when our sleep is not being great. And some of the things that we do around it and how we start adapting our lives to it tend to be quite similar. And so even in the most complex case, even in someone who really thought that they were the 1%, and that is often what patients will say to me, that they are somebody that cannot be treated, that they know that I've had success rates, really good success rates with other people, but they're terrified they're going to be that one person that doesn't get anything out of it. I can assure you, with a behavioural approach, so I call it behavioural sleep medicine, but the treatment I'm talking about is called cognitive behavioural therapy for insomnia, CBT-i for short. That is not the same as CBT for depression or anxiety. CBT is just a very umbrella term for all the cognitive and behavioural strategies, the evidence-based strategies that we know work for a particular issue. So please don't get confused. That's why I tend to call it behavioural sleep medicine for you. But what we tend to see in lots of chronic sleep problem patients, whether it's something they've had for 50 years versus 5 months, is some very common themes running through them. And it's taken a long time and a lot of sleep research for us to tease those out and understand what they are. One of the biggest issues being that the original trigger, which can be incredibly different for everyone, is not necessarily the thing that is keeping that problem going. And through this research and understanding the problem better, we can start to see that there are certain behaviours that are really common amongst people that don't sleep well. And indeed, even when a good sleeper doesn't sleep well just for a little while, they start to do these same behaviours. One such behaviour is starting to actually adapt their entire lives to the problem. So instead of, ignoring the problem, which doesn't sound logical, ignoring the sleep problem and going on about our daily lives, most chronic sleep patients will start adapting things to make sure that they can do everything they can to have that good night's sleep, or they might reduce something that they're doing, or they might not exercise that day, or they just, cancel certain activities, certain social time with friends, anything that seems or deems to potentially interfere with sleep, and suddenly it's gone away. And in that way, a lot of people are very similar in their problem. And if they're not doing that, there's other things like, for example, spending more time in bed to try to, encourage sleep to come, to give yourself every opportunity to have the sleep. And so you start to notice these nuances come out, and that's where even the most chronic, severe patient has always had improvements on my courses, because once you can tease those bits out, you can certainly treat the problem. It does help that obviously I've had a long time doing this, so 15 years around about now, experience of treating lots of different types of patients. And so it's very, very rare to come across somebody who I've never treated before. Most of the themes I see are recurrent, even when they feel like they're not to that patient. And I think the other issue is we don't talk about this issue enough in society, and so we're not aware of so many people struggling the same way as we are. So please don't fear, there is always improvements to be had. Even if you put a normal sleeper through the program that I put through my insomnia patients, they would see some sort of improvements or changes in their sleep, because what we're doing is we're really building the quality and duration of sleep and the regulation of your sleep, which is good for everybody. And so therefore, even in the most severe of cases, you get improvements.